When I was a community pharmacist, this was probably over 10 years ago, my patients did not do well on low salt diets. Their doctor, if you go to the doctor's office and you have high blood pressure, the first thing they're going to tell you is just to cut your salt intake. And a lot of my patients would come to me and say that, they don't feel good. Their exercise tolerance is terrible. A lot of them actually would pass out on a low salt diet because it just bottoms out your blood volume. And so it wasn't matching basically the guidelines saying everyone should consume a low salt diet. It was not matching the health of my patients. And so when I would push back, and they would go to their doctors and say they weren't doing well, and the doctor would say, okay, so start adding salt back to your diet, they would instantly feel so much better. Even people with atrial fibrillation, their AFib episodes would almost go completely away. So right then and there, I was like, okay, something's wrong here with the guidelines. And what's interesting is if you actually look at the level of evidence that's supporting these guidelines, like the American Heart Association, congestive heart failure guidelines telling these individuals to go on a low salt diet, it's based on level evidence C, which is just expert opinion. It's not based on like meta-analyses of randomized controlled trials in humans. It's not just the fact that the evidence does not suggest that this is correct. It's when you actually look at the real world population, so much harm you can see when people start cutting out their salt intake. Only 20% of people with normal blood pressure are quote unquote salt sensitive. In other words, we'll see a significant reduction in blood pressure when they lower their salt intake. Now, I would argue that reduction in blood pressure is actually harmful because you're just decreasing blood volume and you're dehydrating that person. That's not a good way to lower blood pressure. A good way to lower blood pressure is to improve like insulin sensitivity, improve the dilation of the arteries, increase nitric oxide, like do it in a good way. Don't just dehydrate someone by putting them on a low salt diet. And we forget about all the harms that happen. When you start consuming less than about 1.5 teaspoons of salt per day, or about 3,000 milligrams of sodium, all the stress hormones dramatically increase to try to retain that salt. So you have increases in all the artery stiffening hormones like renin, aldosterone, angiotensin II, the heart rate increasing hormones, noradrenaline, adrenaline, things we block with medications to prevent death and cardiovascular disease, all dramatically go up, typically anywhere from 2 to 10-fold. To think that a small reduction in blood pressure, which again is probably harmful, could offset all the increases in stress hormones, artery stiffening hormones, and insulin resistance dramatically goes up as well, is beyond me. That's just myopically looking at one surrogate.
Annotated and summarized, easy to share with loved ones. The description below the title for this video has these summary points.
From the website doctorstotrust.com, you can view the summary notes and share or print the PDF of those notes.